All right, we're back from lunch. Craig, I just want to thank you for joining us.
Yeah, you bet.
It's been a pleasure getting to know you a little bit here.
Yeah.
It sounds like you have an expanded role.
Yeah, it's a new opportunity. Certainly, it's a new organization. So Intermountain Healthcare is the new Intermountain Healthcare. It's the combination of Intermountain Healthcare and SCL Health coming together. Technically effective April 1st of this year, and day one was April 5th. Yep. Nobody really wanted day one to be April Fool's, so we kind of postponed it through the weekend.
It's not a real merger.
Yeah, right.
And you were at SCL.
Yeah, I was at SCL for a little over 3 years, and prior to that I was at Atrium Health for 21 years.
Yeah. And so you're Chief Information Officer, digital. You basically now have the purview to kind of leverage innovation. This is our series on, it's our RCM innovation, but we're always excited to talk to folks like you that have that broader purview, and you're probably doing some of that. You're doing digital transformation. So from an innovation standpoint, what's on your mind? What are you excited about? What are you learning here at Becker's? How do you think about innovation?
Yeah, I think it's probably the most exciting time within healthcare. You have technology and healthcare coming together. You also have healthcare being broken into two words, health and care. Yeah. So you start seeing a lot of the innovative ideas coming from the tech side, but also this is the opportunity to switch some of our focus from being predominantly care to health, which leads us into value-based care and population health and all the things that we've been talking about for a decade and a half to 2 decades. The timing is perfect to have that come together. And when I sit and I listen to other people talk, there's a lot of great ideas out there, but most of those are very transitional. A little bit better tomorrow than we are today, and today is better than what we were yesterday. And I think the time is right to really kind of rewrite the whole script. Our healthcare system, many have said, it is broken. It needs to be fixed. Yep. It's not one where you'll fix one piece at a time. It's almost like starting with a blank sheet of paper. Yeah, blank slate.
Absolutely.
And let's go ahead and start defining what we want healthcare to be, then close that gap of how we kind of move into it. For many of us that have children and hopefully grandchildren, we want those next generations to have a whole different way, a whole different experience of how they enter in and out of our healthcare system.
Yeah. And so, in this new role, what's one of the first couple of big things that you want to tackle and start to accelerate through this phase?
Yeah, well, like many or most mergers, the first thing is really focusing on integration.
Sure.
How can we take the efficiencies, the economies, continuing to lower the cost of healthcare by removing and reducing a lot of the unneeded, unnecessary expense that's out there. So that's first and foremost over the next 2 years. However, quick on that, and in parallel, there's a whole aspect of the digital transformation, which is redefined and being defined many different ways by a lot of people. Sure. For us, it really is taking a look at the consumer component, taking a look at the patient component. A lot of those are related, but also we have our caregivers, our associates, that are our staff that are actually doing the work itself. And then we have our physician providers and nursing providers as well that are doing the hands-on physical care. So all three of those coming together for us are kind of separate channels of work that will be connected together. There's a lot of spillover in between what we can do in one space into another space. Yeah. And there's, like you and I and many others, there's a lot that we can take from other industry that's already kind of in the normal practice of people's lives and bring that in. So it's really an exciting time, and our focus is really to accelerate that work, be very impactful with that work, and be the model for the future of health and healthcare in the United States and globally.
I would think too that there's a great opportunity with two large systems like that to kind of evaluate best practices and kind of cross-pollinate, different ideas and.
Yeah, both healthcare systems bring just really a slew of very brilliant people. And in many cases, it's the classic 1 + 1 = 3.
Yeah, sure.
So when you look at the best practices, and you look at maybe what you thought was a best practice and what I thought was a best practice, in many cases, because of the data that's available, we're going to be very similar. Yeah. In some cases, we're going to be different. We're going to have to look at things differently than how we may have looked at it. I think the benefit of bringing two organizations like this together, is actually the answer might be out there somewhere else.
Yeah.
It's like, yeah, this isn't perfect, that isn't perfect. Let's go find where that is and bring that into the healthcare system and then spread it out.
Yeah.
The advantage we'll have because of the geography that we cover and the different segments of populations and services areas that we have, we'll be able to model things in very tight rural areas, urban areas, anywhere above and beyond and in between. So we'll have a lot of different markets to be able to test things out in and see how much of that is transferable in a whole different segment of the population or a different market, and which ones need to be tweaked because it's just a different group of patients that we're caring for.
Yeah. Yeah, that makes a lot of sense. So earlier when we were talking, you have 7 states, right?
Yes.
So I imagine there's the consolidated view and getting consensus on what's good, but to your point, you have to deal with different dynamics like rural. So there's sort of geography and conditional things that are unique to each.
Yeah, the way that we're structured today is we have one health system, obviously, and that system's going to continue to evolve and grow. So as we continue to be very attractive to the market, we'll have more people wanting to be part of our systems. We'll want to engage more people as part of that as well. Then we have 3 very distinct regions. Then we have markets within those regions. Then we have breakdowns in between. So as you look at the larger system, there are certainly things that are going to be able to be spread across the whole system. But there are things that will have some regional variability and some market variability. And those are the things that will help us really kind of create that overall very encompassing model. So as this type of work can be spread across different parts of the country, that we can be able to tease things out and say, this is best for you, maybe this is best for a system of your size. So really we have the benefit of being that model for the future of healthcare.
Yeah, absolutely. One thing that we've talked a lot about at this conference in this series is administrative waste and the revenue cycle. There's close to $300 billion. When you look at all waste in healthcare, the consensus is $1 trillion, 25% of the the $4 trillion. So that's a big number to work with, right? I would say that's like a fund that we can use to fund new innovation. You feel like you guys you have a strategic plan and around how to tackle waste? And what are some areas of tackling waste that we're after?
Yeah, we're seeing, it's a great question, and we're seeing it and feeling it in all aspects of our workforce. So healthcare in its highest form is about 50% labor, 50% non-labor. So when you look at some of the waste, there's opportunity on both sides.
Yeah.
And now you look at the labor shortage where there's the hands-on caregivers, all caregivers, front end, back end, shared services, the automation piece to do things, utilizing items such as artificial intelligence, machine language, learning. Those things are opportunities for us to bring in. They've been around for years, but not really, we've been such people heavy. Now it's time to really kind of turn that around. We see it in retail, we see it in banking. We see it
we're all used to it as regular consumers, right?
So there's an expectation. You're exactly right. You have an expectation, I have an expectation that needs to be part of our portfolio. And I think there's a lot of opportunities certainly to be shared, but the back end is the piece that we'll be continuing to do some additional focus on, because as the back end causes potential waste or inefficiencies, the person that feels it is typically the patient and the consumer, and those are the people we want to fix. On the other side of things, you're seeing a lot of things coming in on the AI side that really is going to help our caregivers. It's a supplemental type product or a service that helps our caregivers to make better decisions. So the more data, so we'll be data rich, be able to use that data, and as we see things shift, that will then allow us then be able to morph along with what the data tells you. So the objectivity of what we're doing, reducing as much subjectivity as possible, and making the encounter, the engagement with us simple and easy. No different than if I just wanted to transfer money. Listen, do you want to transfer money to me? Very easy to do. You can do it in a matter of seconds. There's no reason why some of our encounters within healthcare, the lower hanging type of services, shouldn't be able to be such as fast and just as easy.
Did you see, we've talked a lot too about just sort of COVID dynamics and silver linings inside of COVID. And you mentioned the imbalance in, demand and supply of labor. some of automation is a necessity, as we know, right?
Yeah.
But what are some of the things that you and probably have to speak through the lens of SEL, right? But like, did you guys have any tangible silver linings, lessons learned from COVID that you're able to leverage?
Oh, most definitely. So there's certainly a lot of lessons. I'll give you just one simple example. It has to do with the low to no touch in terms of taking care of patients. So when the patients were highly contagious, you want to reduce the risk to your caregivers and to their loved ones who may want to come see them. So utilizing the technology to allow interactions to occur, to allow services to be performed, and to allow also the engagement and bringing their family into the room virtually. That whole virtual way, whether it was a virtual sitter, whether it was other types of services, pastoral care, whether it was family coming in, to be able to isolate that patient so that he or she were not able to infect your workforce or others that were around the area. So that was one that took off, and that's one I think is going to be here for a long time, because it allowed us to be, and plus when you look at kind of a lot more of the new concept of hospital at home, there's also now that transition, and you can transfer that technology into a whole another service level, and one that's more comfortable, one that's more convenient. Obviously, access won't be a problem at home.
Right.
So how we can take some of that same learnings and bring that into a whole new service line and a new way to engage our patients is one of the next steps.
Yeah. And telemedicine, right? I've had so many discussions with leaders about, we were going to do telemedicine over a 5 to 10 year journey until our back was against the wall. We did it in 45 days.
Yeah.
Was that your experience? And
yeah, we certainly accelerated that like everybody else.
Sure.
But telemedicine is one of those things that I have a little bit of a lean on. So I'll give you an example. So when I go to the banking example, or if I go to purchase something on the e-retailer side, I don't teleshop, I don't tell a bank.
Yeah.
I online shop in an online bank.
Yeah.
It's a whole different experience.
Yeah.
So I think for us as an industry to mature out of some of that terminology and some of the new terminology, so when people say doing telemedicine, virtual visits, the way that many people are doing is connecting two people together, a provider and a patient, via some kind of electronic means. They can see, talk, hear each other. But that's not really what we've done in the other industries.
Yeah.
That to me is like the drive-through when you'd go to a bank and you have the pneumatic tube and there was a person on the other side of the glass.
Good point.
That you could talk to and move things over.
Yeah.
Now I do things on my phone. I do things on kiosk. There's not a human intervention.
Yeah.
So we have to advance our intelligence to be able to use some of that AI to be able to mimic and actually be more consistent and concise with that type of transaction, so that when the patient wants to enter that, it's not connected to another human. There's actually a machine that has science around it, has evidence around it, that is processing that relationship. Now, if it gets to a point that it can't handle it, yes, let me transfer that over to somebody. But there's a lot of those transactions that should be able to be performed by the machine, not necessarily just connecting two humans together.
Yeah, sure, absolutely. Makes a lot of sense.
Yeah.
What about the notion, data's the new oil. We live in a data economy. It sounds slogany, but it's also just reality.
Yeah,
it's
it
true.
is.
You know better than anyone how much information is created every single day on every device. And what are you doing to, whether it's Internet of Things, or you've got now blending these two systems together, you've got third-party files and there's literally data and signals everywhere.
Yeah.
As you pull that into a central state, what are some of the opportunities, from a just pure data-driven standpoint? With your title, I have to imagine that's something you're thinking about.
Yeah, I think that one of the larger opportunities, obviously, is to make sure that we can fill the gaps in data. So not everybody banks at the same place.
Right.
You may have your investments somewhere else, maybe your mortgage somewhere else. Right. Your financial picture is spread among several others. If you go to the bank or you go to your mortgage, they will know certain things about you because that's where you've had that transaction. Yeah. It's not any different in healthcare. In many cases, there will be transactions, opportunities, relationships with our healthcare system, but they're also using the one across the street for something else. Yeah. Maybe one on the other side of the country for something else. So how do I fill those gaps and make sure that I can still get that full picture of that continuum of how that
Yeah.
patient or that consumer of service is interacting in and outside of the healthcare industry than how I specifically am in there. And I think it works both ways. It's our obligation too to share with others when a patient comes to us, how do we provide that information back so that that caregiver can see a larger picture of what that is. Once you can help fill that gap, fill those holes, the next part, or really in parallel, is to make sure, how do you get that into the hands of the decision makers? How do you have he or she really have the data that they need to make well-informed, precise, concise, and very timely decisions? Right now, if you have to jump out to another system, that provides delay, that provides opportunity for error, and may provides opportunity that I just don't have that amount of time. I may skip that step. So you got to put it into the provider's workflow so that they move that through. If you go back to what we talked about a few minutes ago, I think the same thing is in concept on the self-service side. I have to be able to interface with you, pull data, allow you to be able to make some informed decisions based upon data that I'm receiving from somewhere else.
Yeah.
A simple example would be if you want to come in and you're scheduling yourself for a test, or you're coming in to take a test, if you just had that test last week somewhere else, I may not know that, but you know that.
Yeah.
And we have to be able to consume that data, bring it in so that you can say, guess what, you're not eligible for that because you just had one last week, and the one last week is relevant to your visit for today. So those kinds of I think opportunities are out there to make sure that we can be very holistic, but also have it be so precise that I can give it to the person at the time of the decision, to the provider, but also the next step is giving it to the patient, giving it to the consumer, because they will make the right informed decisions for themselves.
Absolutely. Part of you talking about that makes me think too is like, how do you gather the intelligence from the patient, the consumer, the shopper of healthcare versus, so, because, we are definitely guilty in healthcare of, we'll get in a room and we'll all whiteboard what the patient needs, and it's like, how aggressively are we talking to patients, right? Are we just doing HCAPs, and are we really doing focus groups? And some of the folks that have really to get in that atomic surgical level, how do you guys know what the patient wants, right?
There's a interesting thing. We don't do it today, but it's one of the things I want to bring to the healthcare system to consider. There was one that somebody shared with me, that when people post things about their service or about their interaction, so whether it's a Google review or other type of social media accounts, or they send an email or a text or a letter, that when those things are consumed, they actually are presented immediately back out, almost like a ticker. Like here it is, and all of a sudden there's a thumbs down. Thumbs down, let's take that. So it's very real time, it's very relevant. Somebody can take action upon that if there was some kind of at least the experience was not to the level that the patient or the consumer wanted it to be. Somebody immediately can contact that person and be in there. I do a lot of reviews personally myself, for food reviews and that kind of stuff. And it's fascinating to me, the percent of people I get no replies for, and then for the smaller percent where they will reply back. Whether I had a good experience or a bad experience, the fact that they now know the experience, now it's up to them to go. And I think that data coming in, so hearing it straight from our patients is what we need to do. And even when you look at innovative ideas, like where's the roots of innovation? It comes from our caregivers. Those that are actually doing the work, they have the best ideas. And you can go back 20 years and people have said that, but to be able to make sure you can consume it, digest it, and give it back, because if you don't have that closed loop to bring that back, the next idea they're not going to give you. They just think it goes to a black hole. So I think both from the patient side as well as from our caregiver side, having them be the ones that feed that into us will allow us to process it, make better decisions, and close that loop by getting back with them.
Yeah, that makes a lot of sense. I like makes me think of command centers. In your other example of retail, that could be a lesson learned from retail, which is, and I think there's a few health systems that have done this. I know there's one in Canada that has a full command center. So, you walk in a room and there's 17 monitors, and, patients go out into the web in many places and complain. or give their feedback, give their thumbs up, or give their score.
Right.
So you want to know all that. You want to know what went well and what, where there are complaints. And I do agree that faster that you can get back to them, the more you're going to build that, loyalty and goodwill. Are you going to build a command center, or do you have one?
I don't know about the command center. I'm newer to the organization to know how that happens. There could be something already in place, but in today's world, like you're walking into it, if we get the opportunity to do something like that, and it's something that's not there today, it would be more virtual, I gotta believe, rather than actually a center. It's more of the operations of the center, but it won't be a physical place. It'll be people around the country who have that kind of expertise and that talent that can manage and monitor. And if you look at even things when you try to expand some of that in the different time zones that we might have, I think speed is going to be necessary for us to be different and to be better and to create that model in all the aspects of what we do. So the acceleration is really important. And this specific example, I mean, can you imagine if you wrote a Google review or gave somebody a thumbs up and a thumbs down, and by the time you went to get a glass of water and came back, you got a text or a response saying, hey, this, that, and thank you for your feedback.
Yeah.
We want to make sure we do more of that. We want to make sure we do less of that.
Yeah.
I'm not sure I understand your experience. Would you be open to a small conversation so we can better understand? You talk about the loyalty and you talk about people wanting to come back. They want that kind of engagement. They deserve that kind of engagement, and that's what we need to deliver back to them.
So that makes me think of, the notion of instant data, instant feedback, some of the promise of 5G and things like that.
Yeah.
How do you think about 5G, and it's still evolving, but how do you think about it if you had 5G?
Right.
You think about that, what's
Brian,
possible.
That's great. There is so much more with that now in terms of the throughput and getting things to people that may have part of that digital divide that we talk a lot about. Yeah. It was funny. So today somebody talked about, they made a quote that all of the homeless people in a certain state have smartphones. And I was like, well, that's a great thing to fact check. Let me look and see. Well, at least from the data that I got, it's about 94%.
Yeah.
Pretty big number of people that you want to touch, who typically, in many cases, will get to the end of some type of a chronic disease, and by the time it gets to a point of criticality, that's when they enter the system versus a lot of prevention or management type of opportunities.
Yeah.
But when you looked at that, and you looked at the next sentence, 55% of them change their phones every 3 months. And many of them don't give their real name or who they are, and they're all using the monthly or the quarterly type tools. So it's to me it was a little bit, I want to say misleading, because I think it's just misinformed.
Sure.
That that doesn't solve the problem that we're looking at doing. There's now we understand a little bit more about some of the behaviors. How can we penetrate that even more, or maybe remove that component that maybe use biometrics for authentication, so I kind of know it's Brian, even though you're going to tell me that you're Craig. I have a little bit more about you, so I think some of that's always balanced with privacy and making sure that we respect people and their ability to share things out. But there's a part of me also that feels like when you look at healthcare, similar to a financial score or a financial status, if I want a loan and I go to a financial institution, I can't say, ooh, I don't want you to know about that bankruptcy, or I don't want you to know what I paid late on that bill.
Right.
They have access to all of your financial transactions and how well you are a steward of that work. And I think in healthcare, we need the same type of opportunity.
Yeah.
Certainly there's certain things like a bankruptcy in financial. Somebody may have a terminal disease or some type of that they don't want to have public and shared out. So we certainly need to make sure we have the right security so that we can provide that privacy.
Sure.
But I need to know all about you really in order to make good informed decisions.
Yeah.
If you're able to exclude certain pieces of data from me having that, then I may misdiagnose, I may mistreat. There's opportunity for errors will go up.
Yeah. Well, you're speaking my love language, getting all the data, organizing it longitudinally, having as much as possible to really, ultimately help the patient. You clearly have to do things inside the organization. You need data to, improve the top line and the bottom line. But since the transaction is the patient,
Yeah.
right? People need to be data hungry, and the appetite for data, because sensors, and as we get the data trapped more in real time, and the notion of ultimately 5G and instant, there's just a sea of opportunity, right? But that's going to better position. My next question, analytics maturity. So data-driven maturity, we talk about like Gartner would call it the analytics maturity curve, where stage 5 is the panacea, right? Ubiquitous data and the right insights in the right person's hands at the right time. Do you have a framework for that, for the notion of like how will you become great at data-driven decisions in instant real time?
Yeah, so we are creating something that we're calling the next generation digital and data platform. And that's something that we will be teasing out all the details of that through this summer for a formal presentation and an investment in the fall that will lead us for the next 5 years. And so that is exactly what we're building. That certainly is part of the definition of being the model.
Yeah.
Is being very data driven and being all about digital transformation.
Yeah.
So those two things coming together for us, we're creating that. We have a few select partners already. We have a lot of the work to tease out that plan, the roadmap, and also build on the agility, because as you know, technology and people, we change a lot. Our environment changed a lot. The whole aspect of COVID, or what's the next thing that might come and impact us that's unforeseen that will cause a different disruption. We've got to have that kind of flexibility in our planning of where we can accelerate some of the work that we know, or maybe some things it's just not the right time, but we know it's coming down the road. But we got to be prepared for when that happens, and then we can kind of jump on and get into it. So it's a large investment. It'll be one of our largest investments. It'll be one that'll be extremely impactful. It goes back to exactly right where we started, so kind of like closing the loop. We're going to focus on the patient and consumer, we're going to focus on our caregivers, and we're going to focus on our providers. And so those aspects and those channels of how we bring all that in, and it's all data rich, it's all consuming things, making it digestible, representing it back out, integrating in the workflow, more self-service for the patient or the consumer.
Absolutely.
Really going all the way back as to even why would somebody make a choice to go to you versus going to me? Going all the way back in front. So there's a lot of transparency in there. Many of us, when we go out and we purchase things, we see two things. We see price, and we see the reviews. So that's our value proposition, how much it costs, and how good is it. And so that's something that we need to do. We need to start generating and participating, and be part of that transparency, so that when you as a consumer or me as a consumer is making a choice, we can make that choice based upon the value proposition that health system delivers. And if we do what we want to do and really become that model and spread a lot of that learning, and also learn from others and continue to evolve, then we will be all in a very competitive, compassionate, but easy accessible healthcare system.
Well, my final question, because we got the wind down clock here. Let's just go to like the end of 2025. And bring it home. Like all those things. One or two things. What do you want to get done by the end of 2025?
A couple of things I would say. So 2025, number one, is not that far off. I mean, you can almost reach it. And by the time we start laying some things out, it's going to be what's your 2030 plan. I think by 2025, we should certainly have a higher level of engagement. We should start seeing the transition into value. We should start seeing the transparency and the sharing of data so that people can make those best decisions. So data, digital, self-service, value, really, and I guess probably the last and maybe even the most important is solving for the health inequities that we have, and making sure that everybody has the same access, has the same value proposition, regardless of all the different differences that we have, is bringing all that together so that we are very ubiquitous in our services to all God's people.
Wonderful. Well, Greg, it's been an absolute pleasure.
The pleasure
and
too.
We'd love to have you back.
Sure.
innovation is clearly something that, we're at a tipping point here, and if we're going to tackle some of these things, it's the fuel that's needed. And we need great leaders and great discussions, and including the ones that are, provocative and crazy at times, right?
Well, you're bringing a lot of good thought leadership, and I'm just a little trinket of it. So it's really nice to be able to listen and be part of that as well.
It's a pleasure.
Steal that good.
I want to go
thought.
back and watch some of these things and take copious notes.
Well, if we had AI, you wouldn't have to take notes.
That's
It would
true.
create that
I know. I use my
document for you.
NLP, use my own NLP engine.
That's right.
Well, yeah. Again, a real pleasure.
Thank you.
And we'd love to have you back.
Fun. Appreciate it. Thanks.
All right. Thanks, Greg.
All right.
Cheers.